Good afternoon, everyone. Thank you very much for attending this session today. My name is Sudha Ramani. I work with the Society for Nutrition, Education and Health Action, an NGO in Mumbai. Sneha works on maternal child health and nutrition issues, mainly in urban informal settlements across Mumbai. In today's presentation, I would like to share some perspectives from the front line of ICDS in implementing the concept of convergence. I'm presenting on behalf of the team, Rama, Sushma, Shreya, Sonali, Dr. Shanti, Dr. Armida, and Dr. Anuja. As we all know, in the National Nutrition Mission, there has been an important attempt to converge nutrition-related issues across sectors. But despite this higher level buying, how does this concept play out particularly in the front line of urban informal settlements is something that we know less about. So what we've tried to do in this study is unpack some of the perspectives of Anganwadi workers, the frontline workers of ICDS, and try to find out what they really think about working in convergence with the public health sector. So we did a qualitative study between November 2017 and June 2019 in two urban informal settlements, and we conducted in-depth interviews with 22 Anganwadi workers in these settings. In this slide, we share some of our findings. We found that most Anganwadi workers, they acknowledged that health and nutrition were related and the relationship between them was important. But currently, they also said that convergent activities in the field was very, very limited. Our study was mostly about finding out why this happened. Why was there so little convergence in the field? So we divided those whys into 4 different boxes. Some had to do with immediate concerns that Anganwadis expressed, some with the organizational challenges, some with contextual challenges, and some about concerning roles in the context of NNM. Some of the immediate concerns that Anganwadi workers reported was that they considered themselves as teachers and not really as community mobilizers. They were not always technically familiar with what they considered as health sector issues. They did not live in a cultural environment that was really used to data sharing, so they were scared that if there were discrepancies in the data, they'll be called up and punished. Also, there were very few meaningful incentives for them to work across sectors. In addition to this, they also reported some broad organizational challenges they faced. First of all, there was no dedicated outreach worker for nutrition. There were several routine infrastructural challenges that they faced, like the lack of weighing machines. Sometimes a helper was not there. They also sometimes reported not getting a timely honorarium, and all this somehow made them feel justified if they did not complete their work. Further, the sort of context they worked in urban informal settlements also created its own challenges. There was a large migrant community where a constant update of beneficiaries was needed. The population was not homogeneous, and most of them, the Anganwadis, operated from temporary rented spaces which are cramped, poorly ventilated, and there was a lack of community-based activities which will actually bring the frontline workers together. Lastly, under the National Nutrition Mission, the Anganwadi workers felt that their roles were getting very formalized with stringent monitoring mechanisms. And especially for most of the older Anganwadi workers, they believed that they had not signed up for such roles. They also felt they were not paid according to these roles. So according to Anganwadi workers, these were some of the factors that actually limited convergence. From our field experiences, we have some suggestions for improving cross-sector action. So something that we have to do is align the work timings of Anganwadi workers with that of frontline workers in the health sector. We have to put in place some meaningful financial incentives, strengthen supportive supervision, routinize data sharing meetings, and also encourage dialogue on field level data discrepancies so that it doesn't scare them anymore. And lastly, also encourage cross-sector events. And in addition to all this, we also have to do sector-specific strengthening, address critical structural gaps in ICDS, in urban informal settlements, familiarize Anganwadi workers with the sort of changed role expectations, ensure that their remuneration happens on time, and support the adoption of the data digitalization process. Thank you very much for listening.